You've made the birth plan. You feel good. But then labor starts, and suddenly things are moving really fast. And a nurse suggests something that you weren't ready for and you weren't expecting. And before you know it, you're saying yes to things that you didn't really want. Most women don't know how to prepare for this moment, not the contractions, the split second decision making when someone is suggesting something unexpected and you just don't know what to say. You're not sure what to do in that moment. But then later you wonder, did I even actually have a choice? And that's why so many women walk away from birth feeling like it happened to them. But that's not going to be you, because today I'm going to show you exactly how to stay in control so that you make decisions that exactly align with your birth, with your plan, with your values, not just the hospital routines. Welcome to Trust Your Birth Tuesday, where we cut through the noise, debunk the fear-based nonsense that we've heard about birth, and actually get confident going into your own. Hey, I'm Coco. I'm a birth doula, a coach, a mama of two. And you know what? I've supported other women through their labors and had complete belief in their ability and their strength. But when it was my turn and I finally got pregnant, I was scared. And even though I believed in my body's innate ability to birth, I had to work hard to trust that I could actually do it. Because here's what I've learned. Knowing about birth isn't the same about knowing how to handle birth. Most women spend their pregnancy gathering information, thinking if they've learned enough that they're going to feel ready, but birth doesn't happen in bullet points. That's why today we're talking about how to stay in control when interventions come up. Because having a birth plan is awesome, but knowing how to hold your ground in the moment is what is going to make the difference in your birth experience. In this session today, we're going to cover the 3 most common interventions that you're going to be offered in a hospital setting and how to evaluate them. I'm going to give you a simple decision-making framework to avoid feeling pressured in the moment. And finally, we'll go over the number 1 phrase that you can use to just slow things down and truly stay in control of your experience. So let's dive right in and get into those 3 common interventions that most women are offered in labor and how to know if they're actually needed. One of the first things that your provider will do when you go into labor is check your cervix. And if you're in the hospital, they're probably going to want to check you again and again and again. Now, here's what most people don't realize. Cervical checks do not tell you when you're going to have a baby. You could be 3 centimeters for hours, or you could go from 4 centimeters to dilated in 20 minutes. Labor does not follow a predictable timeline. In fact, studies have shown that labor is not a straight, consistent process that many people think. The Friedman's curve, which is the old textbook model that says dilation should progress at a certain rate, has actually been proven outdated. But you know what cervical checks can do? They can get in your head. If you hear a number that is lower than what you expected, it's really easy to start doubting yourself, even if your body is doing exactly what it's supposed to do. And the more tense and discouraged you feel, the harder it's going to be for your body to stay relaxed and open and for labor to progress naturally and smoothly. So here's how to evaluate if a cervical check is offered to you. Ask yourself, is this information actually helpful for me in this moment, or will it just stress me out? If you do not want routine checks, you can say, I'd like to minimize cervical checks unless they are medically necessary. Because unless there's a specific concern, you do not have to know your dilation in order to have a baby. Your body knows exactly what it is supposed to do. Intervention number two, that is super common. Most hospitals will automatically hook you up to an IV as soon as you are admitted. It's their routine. But if you are a low risk, healthy pregnancy, it's not always necessary. IVs are very helpful if you need medication or if you're extremely dehydrated. But for a normal labor, they can actually make things harder. Being attached to a pole limits your movement, and movement is one of the most powerful tools for managing contractions and having a physiological birth. The idea that you need an IV just in case is frankly just outdated. So here's how to evaluate if it's necessary if an IV is suggested. Ask your provider, is an IV required or can I just drink fluids instead? If you don't want to be hooked up right away, you can say, I'd like to stay hydrated on my own unless an IV becomes medically necessary. Because honestly, unless there is a true medical need, your body knows how to fuel itself for labor. Just like running a marathon, you need to sip fluids, not be stuck to a pole. Okay, let's get into intervention number three that is really common. Induction rates have skyrocketed in the last few decades. And hospitals are now pushing these inductions as early as 38 or 39 weeks, even if there is no medical reason. In 1990, the US induction rate was around 9.5%. Today, it's over 30%. And for first-time moms, it's even higher. I mean, how crazy is that? And you know what? A lot of this comes from something that was called the ARRIVE trial. And that suggested that inducing at 39 weeks might reduce your risk of a C-section. But what most women don't realize is that the study was not comprehensive. It didn't actually look at how physiological birth progresses when left undisturbed. Now, hospitals are using this study to justify inductions, even though there is no reason to hurry labor along. And the thing is, hospitals are businesses. Their goals are efficiency and safety. But sometimes these goals are not aligning with your birth preferences. Inductions help hospitals plan staffing and bed availability, but that doesn't mean that that's necessarily best for you and your baby. Research also shows that first-time moms who are induced have a higher chance of needing interventions, including epidurals and assisted deliveries like forceps and vacuums extraction. Now, here's how I want you to evaluate if an induction is suggested. Ask your provider, is there a medical reason we need to induce, or is this just based on hospital policy? And quick note here, having a baby that is too big is not a reason for a medical induction. If they say it's optional, ask, what if we wait? Simple question. If you're feeling pressured and you don't want to induce yet, you can always say, I'd like for labor to start on its own unless there is a medical need. Because unless there's a true medical concern, your body knows when your baby is ready. You just need to trust that process. So those are the three most common interventions that you're going to hear about. The key is knowing how to evaluate them in the moment so that you don't feel caught off guard. That's where having a simple decision-making framework comes in. So you can pause, ask the right questions, and make choices that actually align with your birth, not just hospital policy. And that's exactly what I'm going to teach you right now. So now that you know those common interventions, let's dive into how you can handle it in a real life scenario. I know I gave you some examples, but this framework works if any intervention is suggested to you. Because the thing is when you're in labor, things can start moving pretty quickly. A doctor might walk in and say, all right, we're going to start Pitocin now. Or, okay, we're going to break your waters because labor isn't progressing as we would like. What are you going to do in that moment? And if you're not prepared, it's really easy to just kind of go along with it because you're not really sure what else to do. But before you agree to anything, you need to slow things down and you need to make sure it's the right choice for you. That's where B.R.A.I.N comes in. Benefits, risks, alternatives, intuition, nothing. This framework is going to give you a quick way to pause and actually think through some of your options instead of just reacting to what's being suggested. So remember B.R.A.I.N. Let's say you're at your 39-week appointment and your provider suggests an induction. Instead of automatically saying, yes, here's how you can use B.R.A.I.N in this real life scenario and decide if it's right for you. Benefits. An induction could mean that you have a predictable birth date and you're going to avoid going past your birth date for too long, which some providers worry about. Risks. Inductions lead often to longer, more intense labors. There's an increased need for medical pain relief, and there's a higher risk of needing additional interventions like Pitocin, an epidural, or even a C-section. In fact, research shows that first-time moms who are induced are more likely to need an epidural and have assisted deliveries. So then go through alternatives. If you and your baby are healthy, you can wait for labor to start on its own. You can also try natural labor encouragement methods such as movement, sex, nipple stimulation, or acupuncture. What does your gut say? What is your intuition telling you? If your gut is telling you that your baby isn't ready or you're feeling uneasy about the induction, that is really worth paying attention to. And finally, nothing. If there's no medical reason to induce, you can simply wait to monitor things. Your body may go into labor on its own in the next few days or weeks, and no intervention will be needed. So know how to slow things down and evaluate your options. But if you're in labor and feel like your provider isn't giving you the space to think, that's where having just one simple phrase can make all the difference. And that's what I'm going to teach you right now. So you know the common interventions now. You know how to evaluate using B.R.A.I.N. But what happens if you're in the middle of labor and things are super intense and your provider is standing over you and saying, okay, we need to do this now. Hurry up and make a decision. In that moment, you might not be able to remember all the steps of B.R.A.I.N. That's okay. You might feel caught off guard. And that's why I want you to just have one simple phrase in your back pocket to use if necessary, something you can immediately say to give yourself time and space to think. That phrase is, I need a minute to think about this. This phrase is very simple, but it is very powerful. It's going to stop the rush and it's going to give you the time to think. And unless it's a true emergency, you always have time to ask questions. In fact, studies show that when birthing women take even 60 seconds to make a decision and pause and consider their options, they're more likely to make decisions that they feel good about later. So let's say you've been laboring for a few hours and your contractions have slowed down a bit. Your nurse comes in and says, we're going to start Pitocin to get things moving again. Most women assume that this means they have to agree. That was not in form of a question. It was just a statement. This is what we're going to do. But instead of automatically agreeing, here's what you're going to do. I want you to take a deep breath and look at the nurse in her eyes and say, I need a minute to think about this. That's it. This one sentence is going to stop the rush. It gives you time to ask questions, check in with your partner, use B.R.A.I.N. to decide if Pitocin is truly right for you in that moment. Or maybe you just need a position change, some food, or some rest. If they push you, just ask, is this an emergency or can I have a few minutes to think? This one question makes it clear that you're not saying no, you're just making an informed decision with your own timeline. Let's put this all together. When an intervention is suggested in labor, here's the game plan. Take a deep breath and say, I need a minute to think about it. Then use your B.R.A.I.N. framework to evaluate your options. And then finally, if they push back, ask, is this an emergency or can I have a few minutes to think? This one strategy can completely shift how you experience birth because you give yourself time to think, to stay in control of your decisions. Knowing this is one thing, Okay. But actually feeling confident in using it in labor, that is a whole nother beast. Because when you're in the middle of contractions, you're not going to stop and analyze every decision like a checklist. You're going to need to have practiced these conversations ahead of time so that they feel second nature. So that when the moment comes, you don't have to think. You just know what to do and how to handle it. And that's exactly what we do inside my Empower Method birth coaching. Because most women do not struggle from the lack of knowledge. They struggle because they don't know how to practice everything they have consumed and learned. Inside my Empower Birth coaching, we practice these scenarios so you and your partner know exactly how to advocate in real time. If today's session made you think, whoa, I really need to practice this and I need to figure out how I'm going to apply this once I'm in birth so I don't freeze in labor, that's exactly what we do in my birth coaching. Click the link below to apply, or you know what, you can schedule a free call with me to just have a chat to see if it's actually a right fit for you. I believe in you, mama, but you just have to stop consuming and start applying what you know because birth is instinctual. So we have to start building those instincts now. I cannot wait to see you next Tuesday as we dive into another hot topic while you prepare for unmedicated birth. See you then.